The name of the project is LetMeKnow. We initiated this in August 2020. So it was initially a very basic IoT device, and then Vithu and Deshan came into the picture with my other friends. We used our expertise from different domains. Deshan was expert in web development, Vithu was an expert in backend development, and we also had a couple of mobile developers in our team, and we built this insanely great platform that could actually solve most of the problems that are found in this medical industry. Initially after August 2020, we developed this. We became the winners of TEDx Global in the APAC region. We won a cash prize of $1,000. And then we participated at the SLIoT, which is the largest IoT hackathon in Sri Lanka. We competed with many universities and became the champions of that competition. Then we applied for this award, which is in 2021, and we won this. We also participated at the Mitra Innovation Nation Sri Lanka. We became the top 10 teams to get mentorship from different people from different domains in the industry, and we won a cash prize on that as well. So we identified a lot of problems in the actual medical domain industry that's making a very huge impact, and one of the things is the early diagnosis system, which is not portable. So we developed this artificial intelligent machine learning system which is deployed in the cloud that could actually predict whether a person is going to get a heart attack or any fatal disease 2 or 3 days before it occurs using the patient's previous data. So by achieving that, we are helping to solve a lot of problems in the industry. One of the things is bed allocations and equipment allocations for patients. So in case, in this scenario when the patient's disease systems or whenever that's diagnosed earlier, it would be easy for the actual people, healthcare professionals who are working in the industry to transfer the patients into equipment available wards or equipment available hospitals, which is going to save millions of lives. So this is not just limited to heart attacks. We are getting X-ray scans, we are getting CT scans, MRIs, full blood counts, urine reports, etc., and which is just 47 different common tests in most of the A, B, C class hospitals in Sri Lanka. So each and everything stacked together, we have a mobile application and a web portal for the hospital. So using the web portal, each and every individual patients, like people like microbiologists, pathologists, consultants, could actually upload patient test report data into the portal, which can be viewed from the mobile application, and we are storing it in a very healthcare compliant method, and those data is going to be analyzed by smart machine learning models, which is going to be actually a decision support system for the doctor. So let's say for a consultant, he needs to visit 3 different wards and 100 different patients. He would be able to prioritize based on the diagnosis, because we have already calculated the health level of that particular patient in our mobile application, which is going to save the consultant tons and tons of time. And we also have a commenting portal where the individual doctors, junior doctors, senior doctors, pathologists, and molecular biologists could actually comment and give reports about that patient's conditions, which helps us get a complete, clear picture of that person's medical history, which is stored in a very health compliant way. So it's an entire system for a hospital management portal which we offer.
So as an undergraduate, it's very difficult for people to come up with an architecture for this kind of a solution, because this is a pretty complex system. This is data driven, and like we are using pretty advanced artificial intelligence model. We can consume a lot of computational power, so we have to place it in a way that doesn't affect the cost as well, because one of our main focus is to give a very cost efficient solution which even an underdeveloped country can reuse and get the benefit from it. So it is very difficult, and we are very concerned about that. While working at Mitra, we could able to experience how the industry is managing the infrastructure, how the solutions are being driven by the efficient architecture and a good solution for the problems. So while working at Mitra, we could able to get that exposure, so that helped us to design this solution in a way that it brings the more features and it add more value to the clients who are using it.
Yeah, so basically my advice to the future interns would be like, work hard, never stop dreaming, just execute. Like, don't wait for your correct time, just execute and learn from your mistakes and never stop dreaming.